Good morning. My name is Dr. Christina Cahill. I'm a clinical psychologist on the Wicklow psychology team, and together with my colleague Dr. Barbara Duffy, a senior clinical psychologist also on the Wicklow psychology team, we're going to be talking to you today a bit about minding your mental health. Many people may already be well aware, but an essential part of pulmonary rehab is looking after your mental health. So that's what we're going to be talking to you a bit about today. So just to start us off, if you can bear with us being a little bit technical for a second, we're going to talk to you about the cognitive behavioural model. This is essentially a framework we use in order to understand a person's mental health. The key idea with the cognitive behavioural model is that thoughts, feelings, physical sensations in the body and behaviours, actions, things that we do are all linked and are all influenced by one another. So when we introduce a situation, this can trigger off particular thoughts, so what's going on in your mind, can trigger off feelings or emotions, physical sensations in the body, and all of these can accumulate and influence how we behave or how we respond. So we're going to look at this in how this might impact something like breathlessness. So let's say you experience a flare-up of breathlessness. Thoughts that you might experience could be things like, I can't breathe, I'm going to pass out, I'm going to die, what am I going to do? Will this ever end? What's the point in taking my inhaler if this happens? This never seems to work. These thoughts might trigger or elicit feelings of anxiety or panic, helplessness, powerlessness. This might trigger some physical sensations such as tightness in your chest or even further breathlessness or increased heart rate. This then might have a knock-on effect on some of the behaviours that you might experience, which could be avoiding good self-care activities like using your medication consistently or even incorrectly. We might avoid doing these because we want to avoid the likelihood of these behaviours occurring again. We might reduce our activity level, thinking that this will help us. Maybe I might sit down for a while. But in actual fact, this leads then to a decline in our limb or chest muscles. This might lead to dynamic hyperinflation, which is where we take an in-breath before our previous out-breath has finished. And then what does this lead to? More breathlessness. So you can see it's a vicious cycle that continues, but it is possible to break out of, and this is what we're going to talk a bit more about. One of the key things we talk to our clients about in psychology comes from cognitive behavioural therapy. And this is that the feelings we experience are never wrong. However, some of the thoughts that they come from can be. Thoughts are not facts, they are just thoughts, even the ones that say they are. Sometimes we think we see the world exactly how it is, but we're actually very prone to making a lot of errors. This can be especially difficult because I think a lot of people have had the experience that someone tells you to stop worrying or, stop thinking about it. Don't get so het up about it. But actually, the more we try and stop ourselves from thinking about something, the more we end up thinking about it. To illustrate this, I'm going to say a series of sentences, and I want you to just imagine what happens to some of the thoughts that you might experience, or what are the conclusions that your mind jumps to as I say these sentences. So I'm going to pause between each one. John was on his way to school. He was worried about the maths lesson. He was not sure he could control the class again today. It was not part of a caretaker's duty. So just maybe seeing what are some of the conclusions or assumptions that your mind will jump to. Anytime I've done this before with clients, some of the assumptions that tend to pop up would be, John was on his way to school, must be a student. He was worried about the maths lesson. This is definitely about a student. He was not sure he could control the class today. Maybe then this is about a teacher or a new teacher about to look after a class, maybe a substitute teacher. It was not part of a caretaker's duty. So that's just a really simple exercise we will often use to illustrate to people or our clients that oftentimes we don't have all the facts or all the information in a situation, and that our mind can jump to particular assumptions or conclusions that may not always be accurate. To talk, I suppose, a little bit further about how this might be related to chronic disease. Stress is, I think a lot of people can be, or a lot of people really notice that stress can play a massive role in managing a chronic disease, particularly for respiratory illnesses. Some of the signs that you might not be coping with some of the stress associated with respiratory disease could be things like feeling like asthma or COPD or emphysema is controlling your life, feeling overwhelmed by all the self-care goals and actions, medication management, having strong negative feelings about having asthma or COPD or emphysema. I wish I didn't have it. Why me? Why do I have to have this? Feeling alone with it, that nobody understands. Having chronic poor self-care. Maybe not looking after yourself as much as your doctors or nurses will say. Withdrawing from visits to GPs or your clinical nurse specialist. These are all signs that we would see quite frequently in people who might be struggling with some of the stresses associated with respiratory disease. And now my colleague, Dr. Barbara Duffy, is going to talk to you a little bit more about some of the things that are, panic attacks and things like that, and is going to explain a little bit more about some of the things that you can do to manage this.
So another difficulty that can develop for anybody who is experiencing a long-term chronic illness, especially if there's anxiety there or stress there, or even sometimes for people depressed or low mood, what can develop are issues like panic attacks. Now, panic attacks are very unpleasant and they affect about 1 in 3 people for at least one point in their lives. And I suppose a panic attack is a very high level of anxiety that can involve serious breathing difficulties and also, I suppose, a fear that is different to anxiety in general. The fear really comes through our thoughts about, oh my God, I'm going to die, or this is going to be the end of me, or this is finally my breath giving up. And then that helps, I suppose, as we talked about the CBT model earlier with Christina, that's attached then to a feeling of heart racing, breathing fast, sweating, feeling tingly. And that then develops into, I suppose, a sense of behaviour, like we maybe want to run for the hills, or we maybe freeze, or we don't know what to do. And all of this is the cognitive behaviour therapy model in relation to panic. And the main crux of a panic attack really is in relation to very fast breathing, which we call hyperventilation. And hyperventilation is really the body's way of keeping oxygen pumping through the body when our hearts are beating faster through panic. But for anybody with a pulmonary difficulty, this can be really scary, and it can actually, I suppose, amount to more severe symptomatology than with other people who do not have breathing difficulties in general. So I suppose, how do you manage a panic attack then when you have a pulmonary difficulty? From a psychological point of view, I suppose the first piece that we would like people to see is that to know it's a panic attack. To know it's not a heart attack, to know it's not a lung attack, and that you are not going to die. And I think weaving that thought process is the first step to helping get on top of any kind of panic symptomatology. Because it's about how we interpret our systems. When we feel that maybe something is very serious or it's going to impact on us greatly, we will have more severe symptoms. Whereas if we know what something is, even though it feels really horrible, maybe severe and unpleasant, we interpret it in a different way and it passes off more quickly and more easily. So we're advising people who get panics not to run, not to avoid, not to freak out, but to try instead to be able to say to yourself, this is a panic attack and this is how I can help myself soothe it. So in the cognitive behaviour therapy model, we can come at any kind of psychological difficulty from 3 areas. 1, from dealing with our bodies. Secondly, with our thoughts. And thirdly, with our behaviours, as Christina outlined earlier. So firstly, in relation to the body, when we're dealing with panic attacks, we have a real status quo deliverer inside the body. The same place where we feel the panic and that hyperventilation is the exact same area where we all as humans have an inbuilt regulator. And that regulator, funnily enough, is also the breath. So our first port of call when we get a panic attack is to say, this is a panic attack and I need to regulate my breathing. There are several ways of doing this. Some of them are easier than others for people with pulmonary disease, but we were also, I suppose, thinking that the breath has to be tackled and addressed to regulate. So one of these little exercises for breathing when we have panic is called the 7-11, where we breathe in for 7 and we breathe out for 11. And we might try that, just 1 or 2 repetitions of that as we sit here. So first of all, just to feel your feet on the ground, whether you're standing or sitting. And an erect body posture to open up the lung area. And I know this can be hard when you're having a panic attack and you're saying, oh my God, but just trying to do it. And then taking a breath as fast or as slow as you need to do with your lung capacity, in through your nose for 7 and out through your mouth for 11. So we breathe in, 2, 3, 4, 5, 6, 7, and out through your mouth for 11. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Shoulders erect again, and breathing in, 2, 3, 4, 5, 6, 7, and breathing out through your mouth for 11. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Sometimes we need to do a number of repeats of this exercise to help regulate the breathing, but in our experience, psychologically, it is really possible. Our breath is always there, our body is always in the present, and it's free. We can do it sitting in the chair, standing in a queue, in the car. The only place we can't put our feet on the ground is in the bed, but we can still practice the 7-11 in bed if we're feeling panicky. Okay, there are other body exercises that can be done to help regulate anxiety and panic in the body. Some of them are called progressive muscle relaxation, and we will be showing you on a slide. There are several resources that you can look into online to get some of these programs where you'll be able to hear them on an auditory level on your computer or on your phone. Also, I suppose the whole idea of exercise, this has probably been mentioned in talks by physios and occupational therapists that you've attended in the past. Our bodies need regular exercise. When we get regular exercise, we're less likely to succumb to panic-type symptoms. So we all know that regular exercise, maybe 3 times a week for up to 30 minutes if we can, even in any capacity, helps to keep our lungs open, but also helps to keep our minds relaxed, and we are less likely to have high levels of anxiety. We then move to the second piece in cognitive behaviour therapy, which is thoughts. So when we have panic or anxiety, we can also psychologically work with our thoughts. Now, Christina talked a little bit about how thoughts are not always facts. In fact, a lot of the time they're not facts at all, and there's not even evidence for some of the thoughts that we have. And our minds are thinking machines, and they make up stories all the time. So when we are having panic or anxiety, it's really useful to just pause for a moment. Take our breath like the 7-11 and try to visualise that we're just standing back just for a moment to get a clearer picture of what's going on. And even though we might be up to 90 and saying, oh my God, I'm not going to be able to cope with this, or this is a terrible thing that's in front of me, or a terrible fear that I'm having, to ask ourselves questions like these. What are the chances that this fear that's in my mind will even happen? Another thing to ask ourselves is, if it does happen, what's the worst possible thing? What's the worst possible outcome that can happen? And then I suppose also to look for some evidence. Am I right to even think this is going to happen? What's the evidence? Or am I just panicking or overthinking here? Another question that we often ask clients to bring into their mind frame is, will this thing actually matter in 5 hours or in 5 days, or certainly in 5 years from now? And finally, there's that piece to ask ourselves, is life too short to be worrying about this piece? Is life too precious, especially when we're living with a chronic illness? We've a lot to be thinking about, a lot to worry about. Is this particular worry worth my energy? And when we move then from questioning the thoughts and taking some breaths, we can move to the next phase in the cognitive behaviour therapy model, which is behaviour, working with our behaviours. And for all of us, I suppose, we need to set some clear goals. We need to know what we're at. Sometimes we're very clear about where we're going or what we need to do. And then other times we can get stuck in a bit of a rut. So if we're in a bit of a rut, it's about maybe sitting down some afternoon and saying, what would I like for me in my life right now that's not there? And what might be doable in terms of getting some meaning or some kind of challenge into my world? And some of that might involve facing fears. We know in psychology that one of the only ways of addressing anxiety, certainly long term, is to face up to the stuff that scares us. There's no other way of getting rid of anxiety, unfortunately, because I suppose a lot of us have crutches. We have crutches where maybe we avoid things, we avoid places, we maybe avoid people, and that keeps us safe. But it doesn't really get rid of the anxiety, because as soon as maybe somebody asks us to do something or go somewhere again, that anxiety builds up. So really, psychologically, working with somebody like ourselves as clinical psychologists, or even by reading self-help books or, tuning into some of the online sites now that can help address anxiety, we might be able to encourage some of you to face some of your fears, because anxiety then reduces and sometimes goes away completely. We also know that balance is hugely important psychologically for all of us, especially if we're anxious, stressed, depressed, and particularly if you're suffering with an additional strain or load of a chronic long-term illness and all that involves. We need to have some regular activity in our lives and regular pleasurable activity in our lives. One of the things that I suppose baffles some of us in psychology still after many years working clinically is the fact that we need to activate in order to be motivated. That for often any of us that are feeling low in mood or depressed, the last thing we feel like doing is going anywhere or doing anything. It really maybe takes us all our time to get out of the chair or get out of bed in the morning. But we all know biologically and psychologically that we have to activate first in order for the adrenaline and the endorphins to start moving in our bodies, and then we start to feel motivated. And some of you may even have found that when you maybe do one little job, it might motivate you then to do another job or to do something else. But the activation has to come first. And I suppose, as I said earlier, about sitting and deciding what maybe needs to be addressed in your life right now. What are you avoiding? Are there things that need sorting? Are there relationships that need maybe reaching out? Are there things that need to be done in the house? And maybe set about writing little lists of things that could be done, small, tiny little lists that you can tick off as you're going along and get some achievement and pleasure out of things that you've got on top of. Even if they are tiny, they all add up. And one of the main things really that we associate with long-term illness and people recovering well or people making the most of the precious life that you have is this hugely meaningful word, acceptance. Many of us, when we're, given a diagnosis, after maybe many years of ill health, asking many questions, going to many doctors, there's a bit of a struggle maybe or a fight against a diagnosis, or sometimes maybe even a giving in, that's my diagnosis, my life has changed, I can't really be the same anymore. And all or some of that might be true. But what we know psychologically is that when people reach a level of acceptance that this is my world, these are my difficulties, this is my lot, that degree of acceptance can then allow you to move on and to make the most of your life, even with additional struggles. Or for many of you, maybe even disabilities, where you can't do things that you used to be able to do one time, or you feel that you can't enjoy life the way you used to. But our sense is that when we can accept that difficulty and that disability, that it's that time that helps us to walk forward. And sometimes we do need the help of a professional to get to that level, or sometimes it's just a bit of time and to maybe give up the fight and say, this is what my load is, these are my difficulties, this is what I need to do every day, but try to incorporate some pleasure and some challenge and some activity in there in some way, if at all possible. I'm now going to pass you back to my colleague Christina Cahill to talk about another concept that helps with stress management, anxiety management and low mood in general, and that's the whole concept of mindfulness.
So as Barbara was saying, mindfulness is a big buzzword at the moment. I think there's a lot of talk about it. It's in schools, it's on the radio, it's on TV. A lot of people have heard of mindfulness before, but what we found in psychology is sometimes there can be a lot of misconceptions about what mindfulness is. For a lot of people, they have the idea that mindfulness means relaxing or chilling out, which is a side effect of mindfulness, but it is not the main aim of mindfulness. Mindfulness is really all about paying attention in the present moment to whatever it is that you're doing, non-judgmentally, without judging it or wishing it were different or trying to change it in any way. And this is what mindfulness is. So how do I actually do it? Well, you may be surprised, but chances are you actually have probably many mindful moments throughout your day, but you just might not even be aware that you're doing mindfulness. It could be when you wake up in the morning and you have your first savouring sip of a cup of coffee or a cup of tea. Or it could be when you get into the chair or into the bed at the end of the night and you hear the rain outside and you feel that sense of coziness. These are all mindful moments. Or it could be when you're absorbed in the middle of a particular task, doing a crossword or the knitting or tinkering around with the car. You're not thinking about, stuff that's happened in the past or worrying about the future. You're in the here and now. That's mindfulness. But if you're ever there and you're trying to introduce more mindful moments into your day, some of the ways that we would talk to our clients about trying deliberately to practice mindfulness is trying to focus on one thing at a time. Trying to observe your experience through your senses, through smell, taste, touch, sight, sound. Trying to notice what it feels like moment to moment. We spend an awful lot of time in autopilot. We are going and doing things, without even being aware. The thing I will often say to clients is, do you ever have a journey where you're traveling in the car and let's say it's a 20-minute journey or something, you're going to work in the morning, you're going to your medical appointment and you get out of the car and you think, I've no idea how I even got here in the first place. That is what we call being in autopilot, which is fine, but sometimes we need to introduce more mindful moments to our day. Oftentimes as well, we will ask clients to try and adopt a curious rather than a judgmental stance. If anybody has ever heard of David Attenborough, who has lots and lots of wonderful nature documentaries, and if you ever see him out in the wild, he always has this lovely, curious, kind of stance as opposed to trying to get into the thick of things. So sometimes, we'll say to clients, adopting that David Attenborough curious stance rather than a judgmental. Noticing thoughts as mental events and letting them go. This is just a thought. This is not a fact. I am not my thoughts. This is just, something that has come into my head and I can let it go. Sometimes we need to return our attention. Our minds are like a muscle and they're built to flex. Our minds will wander again and again and again. We're not built to focus on one thing for much of a length of time at all. So sometimes we need to return our attention deliberately. We'll often say to our clients that training your mind in this way is a little bit like training a puppy. Puppies can make messes or can go places you don't want them to go or bring back things you don't want them to bring back. And our minds are a little bit like that as well. In the same way as training a puppy, training our mind, we need to be patient, kind. We need to repeat ourselves quite a lot. And I suppose these are some of the ways to try and introduce a little bit more mindfulness into your daily life. One of the other ways that you can introduce more mindful moments is by using what we call grounding exercise. So one of the things that Barbara spoke about earlier in working with the body and the 7-11 breathing exercise, these are all grounding exercises to try and get you into the here and now. But another way you could do this is with a very simple exercise. You don't need any guided. This is something you can do yourself. And we call it the 5-4-3-2-1. Very simple. You can do it in the car, waiting in the doctor's clinic or in the bed or sitting, first thing in the morning. It is 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell or smell of, and then taking 1 deep breath. So even if you were just to practice this here and now while we're speaking. In the same way as Barbara had said before, trying to adopt that kind of erect posture with both feet on the floor and trying to look around and identify and name 5 things you might be able to see. And then trying moving on to 4 things you can hear. Moving on then to 3 things you can touch. And then 2 things you can smell or smell of. And then finally at the end, taking 1 deep breath, maybe doing the 7-11. In through your nose and out through your mouth. And you may need to repeat this a couple of times, but this is a really simple exercise that you can use anywhere at any time in order to ground yourself in the here and now. And finally, just to finish us off, my colleague Barbara is going to be talking to you about some of the resources that are available for you right now out there to get help.
So we've just given you an overview really in relation to minding your mental health, utilising the cognitive behaviour therapy model. We've given you ideas how to understand anxiety, stress and maybe low mood, and also some pieces of information in relation to how you can manage those difficulties. And one of the pieces that is really hard, I think, for anybody who's carrying the extra burden of a chronic illness is that it can be difficult to cope, even with the strategies that we've outlined today. Some of you are able to maybe manage really well with some of those strategies, or with a really supportive family, or with just your outlook on life or the level of your disability with your long-term illness. For others, that struggle might be more difficult. And I suppose our message to any of you out there who feel that you're struggling and not able to cope and need help, we really would just advise you to do one thing. You're probably very used to going to your doctor about your long-term mental or your long-term physical health. But what we're maybe asking you to do is, if you feel like you're struggling, to maybe speak to your GP about that mental health struggle. They have all of the information in themselves to assess your situation, and they know all of the support services that are available in your local area. There's usually a psychologist in primary care in most towns in Ireland, and there are definitely psychologists associated with the mental health services in all areas in all of Ireland. So we'd really be recommending anybody who is feeling that they're not coping or they need a little bit of additional support, professional help or guidance, to maybe help walk them through some of the ideas and interventions that we've mentioned today. We would strongly encourage you to do that. The other piece, I suppose, is there are a number of other societies for psychology and counselling and psychotherapy located in Ireland that if you wanted to give them a ring or go on their website, there are contact numbers for therapists working in your area that you may wish to attend privately. And then I suppose there are also other services like Pieta House, accident and emergency. Always, if you're feeling low or suicidal or you can't go on, we always recommend Care Doc or accident and emergency, even out of hours. And there's always Samaritan's Helpline, phone 116 123 24/7. Every single day of the year, including Christmas Day, there is always somebody there to listen and to be with you and to provide support. There's some other services that are available online, various websites that will be on your screen, including yourmentalhealth.ie, drinkaware.ie, samaritans.org, and many more. The beaumont.ie service listed on your screen is a really, really helpful resource. They have many mindfulness techniques and auditory guided mindfulness programs on that website that are free. They also have breathing exercises and progressive muscle relaxation exercises. That's an excellent website to get onto if you're looking for help, to help you get on your own journey of self-help around relaxation and mindfulness in particular. And there are loads of really helpful books on the market. There's a system really between a lot of the libraries as well now in Ireland, that they are stocking mental health books in their libraries, and they are usually labelled in the library. So to maybe, if you wanted to ring or ask your local library if they stock mental health books and positive mental health books, that is a strategy that's been adopted by many of the libraries in Ireland to date. We have that in Wicklow definitely, and it's called often The Power of Words is the programme that's developed in conjunction with many Irish libraries. So a lot of the books that you'll see on your screen may be available to borrow from your local library, but they're definitely available to buy or to order through your local bookshops or online. And there are 2 sheets there of book recommendations. So we wish you well in your ongoing journey with chronic illness. We hope that there are some little bits of information that help you to understand where you're coming from, how your responses are, and maybe other strategies that you could use to help in some situations in your life, and maybe also a need for additional help or professional support through your GP if you feel that that might be required. We wish you well.